Great. Hello, everyone. We're just getting started, letting people in. We'll give it another 30 seconds or so and we'll get started. Let people in and people start joining. Great. Let's get started. Good afternoon, everyone. Thank you for joining us today. Today, we're going to be talking about leaves, out of office in compliance, managing employee leaves. You just have me today. I'm Tasha Wilder, Senior HR Consultant here at Innovo. A little bit about Innovo before we jump in. We are an independently owned boutique employee benefits brokerage. We're out of Concord, Massachusetts, and we work with our clients to create and manage competitive benefits packages that will help your organizations attract and retain their top talent. We also offer fractional HR services, benefits administration, and in-house COBRA. We may look small, but we are mighty. We're actually one of the largest independently owned brokerages in Massachusetts. A little housekeeping before we begin. We're going to have a few polls throughout the presentation that you can interact with. We also have a Q&A feature that you can send your questions to. We have our VP of HR, Allison Hay, who's going to be monitoring that and trying to answer your questions in real time. And then at the end, hopefully we might have a little time to answer some of those questions. We're going to be sending out this presentation to everyone who has registered. So you'll get all of these slides. And then also at the end, stick around. There is a quick survey and then also your SHRM and HRCI credit should you need those. Okay, the agenda today. So today we're going to provide a general overview of each of these topics. Each one could be a whole presentation, but I'll give a brief overview of some of the federal laws, paid leave laws, and then we're going to jump into some scenario approaches. And then a few of you sent in questions ahead of time, and we're going to get to those at the end as well to try to address and touch on all of these topics in that really kind of real life day-to-day scenario approach. All right, we got our first poll here. So what is your biggest challenge in managing leaves? That's going to pop up on your screen there. Compliance, employee questions, administrative process, staffing. I know there should be one that says all the above, but try to choose which one's your biggest. The results are coming up here. The administrative process, overwhelming response there. And yes, I agree that can be challenging, and hopefully we'll get to some of those admin questions. Let's see, and then how many employees does your organization have? Okay, let's see. Okay, we got, many who have over 100 plus, that 50 to 100. So with more employees brings different protections and things you have to offer. You're going to be in that 50 to 100 plus in that FMLA eligible category. So we'll touch on that as well. Next slide here. All right, so let's jump in. So I'm assuming you're here, you want to learn more about leave, but perhaps also because leave administration has really become increasingly layered. As you can see here, all of these circles here represent all of the different areas of leave management that leaves can touch. The expanding state leave laws. So there's many different programs that are, in over 20 across the US that have their own leave programs, their own paid sick leave. They're going to continue to roll across. The remote workforce in the last, 5-10 years, we've seen an expansion across the US, which is wonderful to increase your talent, but also creates a lot of complexity in states that you have to set up and in that leave space. Employee expectations. So, employees are expecting that timely, accurate, that you're going to have all of those leave answers for the state that they're in, for the situation that they're in. And there's those compliancy, consistency risks, making sure that you are providing the correct notices, applying the correct circles to each one of those leaves. And we said it, the admin procedures, the operational strain, understanding and managing that coordination across those benefits, payroll, managers, the admin task. It has become increasingly layered and more difficult, frankly. So one absence can trigger multiple obligations, the different leave, the leave puzzle of what a leave can touch. And so we'll talk about each of these pieces, but you have your federal layer protections, kind of that umbrella of the FMLA, the ADA, the different state leave laws, and that provide the wage replacement. So you can have a short-term disability plan or wage replacement through state leave. Do you have an employer policy that has a parental leave policy, a sick leave policy, top off? And then not forgetting about that disability accommodation. Those are areas that each layer can apply at the same time. Each layer has its own eligibility, paperwork, timeline, and can be applicable for each leave. So it understandably can get complicated. So just going to quickly talk through a few layers of that leave, kind of a refresher for folks. So when we talk about kind of that umbrella, that federal level leave, so the FMLA, so the Family and Medical Leave Act 1993. So this is going to provide that layer of unpaid job protected leave, benefits continuation, and job restoration at the end of the leave. And that is for eligible employers, 50 plus, with a few nuances there, and for employees based on their tenure in that position. And so while FMLA itself has not changed much in the 30 plus years that it's been around, the DOL does put out these opinion letters, and these are just a few from the past couple of years. I won't go through all of these, but they put out these opinion letters to interpret how time can be used and how to apply FMLA. While these are not binding law, the courts generally take a look at this to interpret the guidance of FMLA. So take a look at some of these if they apply to you, and keep an eye out for those opinion letters to help work through that FMLA process. And then you have two other layers, your paid sick leave and your state PFML. So these are two separate buckets when we think about leaves and things that can apply. So your paid sick leave, so there's no federal paid sick leave law, but there are state sick leave laws, local regulations that require your employers to provide employees with compensated time off. So each state is going to have different qualifying reasons. Might be based on the state, a different or municipality, depending on the state. And so those usage reasons, those accruals are going to vary by state, i.e., 1 hour for every 30 hours worked, up to a maximum of 40 hours. So this provides short-term, fully paid time off that is protected. It's required at the state level, but managed by the employer. It's on the employer's onus to make sure that employees are granted the sick time or more generous per the state that they live in. And then you have your state PFML. So these are for longer term leave. So either your own serious health condition, bonding, caring for a family member, military emergency, and these are partially paid. That typically covers a percentage of your average weekly wage. They're funded through a state-run pool that's paid through the employer payroll deductions, and that's regulated at the state level. So those are the two pieces when we're talking about state leaves. And this is just an illustration of the states that have paid sick leave laws, so that you're required to provide fully paid time off for employees that are in these states. Again, varying accruals and various reasons for usage. And when you're looking at states, for instance, like California, different municipalities may have different different accrual rates. LA, San Diego, San Francisco, those may differ slightly and be more generous than California. So take a look at your workforce, take a look at your policies to ensure that you're meeting these sick leave standards. And then this is another illustration graphic that shows that paid family leave. So in that dark blue there are going to be the states that have a paid family leave program that is statutory, that employees and employers have to pay into. You look at that light blue that has the paid sick leave, only kind of another layer of that paid sick leave. There's states that have voluntary paid family leave program like Vermont and New Hampshire. And then we have a few upcoming states such as Maryland and the newest one, Virginia, that are going to have paid family leave programs in the coming years. Definitely keep an eye out for this. We do as well and send out those communications. I think we will definitely see more states that are going to be implementing that PFML. And then another layer that your organization may have, this is not a required benefit, but a lot of organizations have a short-term disability policy. So this is an additional insurance that you broker through a carrier, and it provides income replacement for an employee who's unable to work, and that's only for their own serious health condition. So typical benefit might be 60% of your salary up to a maximum of $2,000 a week, has a waiting period, could be for 12, 13 weeks. And this benefit adds another layer that it can be offset. The state paid leave benefits are going to pay first, and then the short-term disability will come in and top that up if those numbers allow that. This is also another way to create that consistency for a multi-state workforce for employees who might not be eligible for any state or federal leave. This creates that income replacement for them. And if that wasn't enough, don't forget about the ADA and the PWFA. So this is the Americans with Disabilities Act and the Pregnant Workers Fairness Act. So in the leave process, there may be, or before the leave process at the end, there may be an opportunity to engage in the interactive process for ADA. The ADA also applies for a smaller amount of employees, 15 or more employees for private employer, state, local, that you have to abide by the ADA, whereas FMLA is 50 or more. And this is just making sure you're providing opportunities, accommodations for people, employees who have disabilities, so that they can perform the essential functions of their job. And so just remembering that that might come into play in some of these leaves. And then the PWFA. So this is an additional protection for pregnant workers that was passed in 2023. That applies again to all public, private sectors, 15 or more employees. That just creates an additional layer for pregnant workers, either post, during, or pre-pregnancy. And this is similar to the accommodation process, but it is a condensed, truncated version where if someone is requesting an accommodation, or that they need an accommodation, that they're not going to go through kind of that extensive documentation. For instance, if a worker needs more rest breaks, if they need a stool to sit on, you're not going to make them go through that process of providing documentation. You're going to grant them that under the PWFA and just document that. All right, a few quick polls. Have you seen a change in leave requests over the last year? Hey, an increase. We've seen the same. And then how many states do you operate in? Okay, we got variety of answers, but still, depending on what those states are, can create really a complex landscape. All right, so let's jump into some scenarios here. And so I'm going to approach these as, the scenario and then these kind of 4 areas. So what are your questions to ask? What are the applicable laws? What are the risks? And what are the best practices? So here's an example, a situation: an employee works remotely from a different state than the company headquarters. So in this case, the remote employee is in New York, the company headquarters is in Massachusetts, and they're requesting maternity leave. So you want to ask yourself those key questions. So, New York, Massachusetts, they both have paid family leave, but what state leave laws apply? Does the work state have a PFML program? Are those deductions being taken? What different applicable laws apply? So in this case, an employee who is in New York, I'm going to assume they're not commuting to Massachusetts. Their remote workplace is primary to New York. So they should be taking a look at, are deductions being taken? Are they set up in New York? Are they paying into a New York paid family leave program? Because that's where they should be applying for their claim. So in this case, the applicable laws, so we're going to assume they're FMLA eligible. This is an FMLA eligible employer. So they're going to be eligible for FMLA. They're going to be eligible for that protection. They're also going to be eligible for 2 parts of leave. So in maternity leaves, in a birthing parent, I kind of like to think of it as 2 chunks of the leave. You have your recovery period, which can be prenatal and postnatal, and then also your bonding leave. So the first part of the leave is going to be covered by the New York State disability. So for 6 to 8 weeks, or however long it takes to recover, they're going to be eligible for that, which is concurrent with FMLA. And then they're going to move to, after recovery, to that bonding leave. And in New York, that's 12 weeks of paid family leave for bonding. The rest of that bonding time is going to run concurrent with the 12 weeks of FMLA. But here's you got to look at what is protected as well. So New York State, the disability and the paid family leave are protected. And then looking at, are there other sick time or other time off? So in New York, they have an earned sick and safe leave. They also have a prenatal leave, which requires all employees to be given 20 hours of prenatal leave so that they can use that time for appointments. And so that is a separate bucket. It's not taken out of any of their other earned time. So just taking a look and looking at what are the applicable laws and applying those. Some of those risks are the wrong state payroll deductions, treating the home office as the work site, and not applying the right usage of time. Here's another scenario that you may see come up. So an employee is taking leave to care for a sick family member. So in this situation, the employee is in Massachusetts and needs to take leave to care for an ill mother-in-law receiving treatment. Again, you're going to go through the same process. Going through a consistent process and a checklist is going to mitigate that risk and ensure that you're treating each employee the same way. While the outcome is not going to be the same, the process should be the same. So you're looking at those key questions. What's the employee's relationship? Does the family member meet the definition? Is it a serious health condition? What documentation or certification is permitted? So in this case, the employee is not eligible for FMLA because the definition of a family member under the FMLA is more narrow. So the mother-in-law is not a definition under the FMLA. So that's not going to be applicable. So they're going to be actually denied for that FMLA. But in Massachusetts, it has an expanded member definition, and mother-in-law is included in that definition. So they're able to take time off to care for their mother-in-law under Mass PFML. And so, you can communicate to them those 2 pieces. So relying on that FMLA documentation, working through that process of providing the rights and responsibilities notice that's saying they're not eligible due to the relationship, working through the designation notice, but also communicating that they are protected and able to take that leave under Mass PFML. Another risk here is just denying the leave based on that narrow family member definition. Having them provide more documentation that's needed. So under FMLA, we don't need them to provide that documentation on the FMLA form. We shouldn't have them fill out more information that's required. We know they're not eligible, so don't have them go through the process of something that they don't need to. Again, that standardized intake eligibility, working through all of the leave laws is going to be your best course of action. And managing intermittent leave. So this is a tricky one. Intermittent leave always gets the most questions. It becomes the most tricky because it's not, it can vary. The times are not always consistent in this situation. And we have a few more questions at the end that's going to dive deeper into some of this intermittent leave because we get quite a few questions on this. In this case, the employee is approved for intermittent FMLA for a chronic condition. The absence, frequency, and duration shift over time. The certification doesn't really match the absences. So again, working through the process before we're just jumping to the solution, jumping to discipline. So going back to the beginning, is it properly designated? Is it properly tracked? Are we sure that it's matched to the certification? Can we seek clarification? So we're going to follow that process. So if someone's leave becomes it doesn't match that certification, which often it might not. If they're, they were out for, the documentation says they're going to be out once a week for treatment, but now it's become 2 times. We can go back to them. You are allowed to recertify every 30 days at a minimum, or upon changed circumstances. It's legal to say, we need some recertification. Hey, we're seeing you need to be out on leave a little bit more. It's not matching. Let's take a look and see if those circumstances have changed, and let's get that documented so that we can then match that leave to that documentation. The risks there, just disciplining or denying those leaves when we're not requesting that certification. We're not treating them the same as others with attendance issues. Again, just working through that process and that checklist of applicable leave laws and practices. And this is another one that we get a lot, and you feel like you don't know what to do when there's an exhaustion of leave. So an employee has exhausted their FMLA, their short-term disability, their state paid family leave, and they still cannot return to work. What do? You kind of feel like your hands are tied. So again, look back and make sure, has the employee actually exhausted all of those leave entitlements? How is your FMLA tracked? Is it on a calendar year? Is it on a rolling calendar year? Have they actually exhausted all that, or are they now eligible for a new lot of FMLA or state leave? Is there any other state leave or PTO or company policies? Just ensure that they actually have exhausted all of that and document that they've exhausted that. And so leave exhaustion doesn't always end your obligation. So what this should do is trigger that interactive process. So once the leave entitlements are exhausted, the ADA conversation begins. So working with that employee to get communication and documentation from their physician to see how long they may need more time, because additional leave can be an ADA accommodation if that additional recovery time is getting them back into their role so they can perform the essential functions. Everyone always asks what that number is. What is unreasonable or an undue hardship? There is no magic number. It really depends. And get that medical estimate, get that documentation, and determine if that is reasonable. When we're in these situations where the documentation is not clear, or the leave is just extending for a time that just does not feel reasonable, that's the time to jump in and get counsel involved in these situations. It's the best route to get, executive leadership, get counsel involved to see what your next steps are. Is this someone who actually is going to return, or do we need to terminate that? And can we do that legally? Great. So when you registered, you were able to send in some questions. And so I was able to answer some of those. I have some slides on those, and we're going to address these here. So, and this goes back to some of the slides I was talking about earlier about pregnancy leave. How do the laws layer? I think this is a very typical question. And again, with the different states and laws can get confusing. So in all of these different categories, so you have your Title VII leave protections, your PWFA, your ADA, and then you're going to have your FMLA, your state PFML, your short-term disability. All of these can touch at some period. Here's a nice representation to kind of visualize how these layer in. So, if you are an FMLA eligible employer, if, this employee has job, is eligible, you kind of have that umbrella. So your FMLA, that's going to be your first, your first process piece. Are they eligible for that FMLA? Providing them that documentation, whether they are approved, not approved, and that's going to protect them for their recovery period and bonding period for 12 weeks. And then your state leave. If you're in a state that has a state leave program, that's going to run concurrent with FMLA. So that is going to be wage replacement and or job protection, depending on the state. 6 to 8 weeks typical, could be longer. And that's going to, again, run concurrent with FMLA. And if you have a short-term disability program, so the state is going to be your first payer. And then your short-term disability is going to top any of that off. Again, all running concurrent for your recovery period. Then if you're in a state that has a paid family leave program, that's going to come in after your recovery period. It's going to have some overlap with your FMLA. And again, that provides wage replacement and or job protection for, depending on the state, another 8 to 12 weeks. And then if you have a company policy, that's going to be your third payer here. So you're going to, whatever the wage replacement is per your company policy is going to top up the state disability, the short-term disability, and then your company paid leave. So that's kind of a graphical representation of how they run and layer together. We'll dive into just specific. So this is another nice graphical representation. This always helps me to kind of discern what protects and when and where. So this is a Massachusetts one. And this is an example for a C-section birth without complications, typical 8-week recovery. So on the top here, you'll look at what are they protected by, the job and benefits protection. So under the FMLA, again, that umbrella, but also under Massachusetts, additional protections for a longer period of time. And, similar to that graph in the last one, your wage replacement for a serious health condition under Mass PFML, if the company has a short-term disability plan, running as the first payer and the second payer. And then after that recovery, the wage replacement for bonding, which is an additional 12 weeks. So this person can be protected and out for 20 weeks, should they file for that. All right, so this goes into the intermittent leave, diving a little deeper. We had some questions about intermittent leave. So when someone is approved for intermittent leave, how can you be assured they are using the time appropriately? This is a question we get a lot, and really your best defense to this is just managing it through structure, process, documentation, and following that consistent approach. So requiring the call-in for each occurrence. So the same procedure as any other absence. You have to call in, 2 hours before your start of day. Here's who you notify, and make sure that's applied consistently across all employees. That's a consistency is key to mitigating that risk and that retaliation exposure. If you are requiring that call-in is different for someone on a protected leave than a non-protected leave is where you can run into issues. Tie as I said in that other intermittent leave slide, tie those absences to the certification. When that pattern doesn't match the certified frequency, request that certification. and then recertify on that defined schedule, or if circumstances change, you're allowed to say, hey, your documentation is not matching what your absences are. Let's get recertified. And then you want to avoid those gotcha moments. They tend to create that retaliation exposure. So if you know that someone is not using their time and you're surveilling them, or you're treating them differently, even if you're right, you can create that retaliation exposure. It's not likely going to win, because you're treating them differently than you would someone else taking a leave. If you're not applying that to your workforce, that can be looked at as retaliation. So it's just important to stick to that structure, that documentation, and that process, and communicating and documenting all of those. Stick to the facts of it when managing that intermittent leave process. Another intermittent leave. So can an employer discipline an employee for reporting intermittent leave for a reason unrelated to their approved leave? Yes, but only for that unrelated absence, not for the protected one, and only if you're going to discipline them in the same way that you would anyone else who is taking abusing their time off unrelated to that absence. So this is important in that tracking process. So separate those absences. Make sure that you're tracking those hours distinctly from those non-FMLA absences. You're applying that policy uniformly. So same call-in procedures you'd use for any other employee. The inconsistency is the most common retaliation trigger. So documenting that unrelated absence. So write down the date, what the employee reported, how it falls outside that condition. You want to remain biased, rely on those facts, check yourself to see, are you disciplining them or have a harsher response because maybe you're conflating those absences and just looking at those outside of the protected leave. And yes, you can discipline, but make sure it really is for those unrelated absences. Next question. Here's one. How can an employer designate FMLA leave when an employee declines to provide certification? So the short answer is you can't. But to expand on that, so once the employer knows about a need for leave, they know about the absence, you have to designate FMLA. But if the employee doesn't provide the certification, declines to provide the certification, the absence loses its FMLA protection. So designation is the employer's job. So once you have enough information to know an absence may be FMLA qualifying, you have to start that process. You have to designate it and work through those steps of certification. So an employee can't decline to use the FMLA because they want to save the time. You have to start that process. So certification is required. So notify the employee in writing. So that WH-381, which is your rights and responsibilities to the employee, where you're also going to give them the certification forms. They have 15 calendar days to return that certification. You can allow more time if they are, good faith and are getting that certification, but 15 days at a minimum to return that, and then providing them that WH-382. So that's that designation form that's going to approve or deny. You can also ask for more information. If the certification is vague, if they need more information, use your forms. The WH-382 will say, we need more information, and they have 7 days to provide more information. And then if they're just not participating in that process, the employee has the responsibility as well. If an employee does not provide that documentation, doesn't provide it, then the FMLA is not approved. And your notice and your timeline or your records and how to mitigate that risk, that you in good faith were working through the FMLA process and that employee didn't comply or participate in that process. Here's a good one. So what leave management mistakes most often create payroll or financial implications, and how can HR prevent them? So this is one, that we see are not those big blatant errors. It comes from those seemingly smaller ones. For instance, the wrong state PFML deduction. So taking a look at your workforce, mapping your states, making sure that folks are mapped to where their primary work location is. If they are remote and they live in a state, they should be mapped to that state for PFML for tax purposes. Audit that annually, and then also I like to recommend that you have some best practices, some guidelines. If someone is going to be moving to a new state, that they provide you that information, 30, 60 days in advance so that you can ensure that you're setting up that state if it's not already set up, that you're applying the right PFML deductions to that state, because that can be an area of risk. Another area, health benefits that are dropped mid-leave. So whether that's intentional or unintentional, FMLA and state leaves, most state leaves provide the protection for group health continuation. So just ensure that none of their benefits are dropped during that leave time. And then top off of PTO usage. So while the FMLA requires an employer to have an employee exhaust their PTO, you can require that. There's a lot of states that prohibit the mandatory usage of their PTO. On the other side, you can't deny that PTO usage either in most states with the PFL. So confirm that before topping off or setting those standards. And then this is one that's pretty complex, and I think is probably that administrative burden everyone was talking about, those wage replacement. So if you have a top-off policy, trying to coordinate that state PFML payment that's going to pay first, that short-term disability offset, and then finding out what the delta of that is to top off. And so just staying on top of that, while it's not a big legal risk, it can create a payroll burden if you've miscalculated and now that employee owes quite a bit of money on the back end of their return. That's kind of a morale issue as well. So just staying on top of those payments and making sure you're getting close to those offsets. And then another piece, that missed reinstatement of deductions. So on return, restarting those benefits that may have been zeroed out when they take a leave because they might not be getting pay. So your 401k, your FSA, making sure those are all turned back on when an employee comes back to work. And then inconsistent PTO accrual. So deciding and interpreting whether or not you are allowing accrual of PTO during your paid or unpaid leave and applying that uniformly. So, company can decide if someone's on a paid or unpaid leave if that PTO continues to accrue or it starts accruing when they come back. Oh, this is a good one. So if someone is out for back pain, they're not on FMLA or PFML yet, and you offer light duty, our employee is required to respond. So we hear this light duty. You may hear this a lot and related to workers' comp. So if this is a workers' comp related injury, that changes the scenario. You can offer light duty. And then if an employee declines it, their workers' comp benefits can be affected under whatever policy. But when you hear, when you think of light duty or someone comes to you and says, oh, I have some back pain, I hurt myself over the weekend, whatnot, you may think, okay, I'll just offer them light duty. I'll be nice. I won't document this. We should really back up. And once you hear that someone has an injury, we should start engaging in that interactive process. So getting more information to see, actually, do they need a leave? Do they need an intermittent leave? Or is this really just an accommodation? We can't just assume that light duty is going to be the reasonable accommodation for their injury. We have to engage in that interactive process. Again, coordinating with the ADA and documenting. It might seem like overkill just for someone with back pain, but it could progress into a leave. It could progress to a longer accommodation, and we just want to make sure we're working through that process so that we, again, working through the consistent process. And then how to create equity across staff when workforce is in multiple states, especially when you're in multiple states across the country that may not have paid sick leave. We get this question a lot, and how do we make sure that we're treating, making it consistent across the board. While it's certainly legal to offer mass paid family leave, and someone can be out for those 20 weeks for parental leave if they are a birthing parent, but not offer that to someone who's not in a paid family leave state is legal. You may want to create that equity to create that culture and improve that morale. So there's some things you can implement. A company paid parental or medical leave program where you're topping off, or you're providing pay for those folks who are going out on leave if they have a serious health condition. It's that company paid leave is reduced if someone also has, a short-term disability or paid family leave, but provides that equity if you have that, for all employees. You can implement a short-term disability plan. So that'll be for someone who's out for their own serious health condition. And it provides another layer of income replacement. Also offsets what the company is paying as well. So that they have some wage replacement if they need to be out. And that uniform policy, company-wide PTO, integrating that and including that in your paid parental medical leave programs, so that it kind of levels the playing field for folks who need to be out. Right. And so, what are some, as we kind of wind down here, what are some of those compliance pitfalls? What are some things that you can get stuck in? As we talked about, I think I've mentioned it quite a bit, that consistent approach, making sure you're approaching it in the same way. So failing to designate timely. So making sure you're working through that FMLA process, designating it where it's required under FMLA, making sure you're understanding each state and federal eligibility. So PFML has its own thresholds in each state, its own waiting period, its own reasons for leave. So just making sure you're double checking those states that you're in. And that treating remote employees by headquarter rules. So like that, New York mass employee, that employee is a New York employee. So they'll be eligible for New York PFML. But, it can get tricky, say you have a headquarters in Massachusetts, but you have folks who are in New Hampshire or Rhode Island. They are commuting to the office, but maybe it's, once or twice a month, and treating them as a Massachusetts employee. Well, their primary work state is really in that New Hampshire or Rhode Island. So making sure those are mapped and aligned to the correct states. And then I think this is almost one of the most important ones, is that manager responses. Our managers, our supervisors are really the first line of defense. So making sure that we are training our managers, or providing information on when to escalate a leave, or know when someone may need a leave, and they don't have to know all of these layers and all of these laws, but just knowing when to bring that to HR, or bring that to someone who is managing the leaves. That documentation piece, it's, we're all, I think most of us here are HR professionals, we're used to document. So making sure we're following the process of certification notices in those tricky leave situations, documenting conversations, either cooperation or non-cooperation in that process by the employee, so that we have that case in that file. And then forgetting the ADA process. So remembering that this employee can still be protected by the ADA when the leave is exhausted, and when to start that conversation, and when, like I had said, involving counsel when that is not reasonable, or when it can be an undue hardship to the employer. Incomplete certification, so that designating timely and cooperation in the process. So making sure that if an employee is providing vague medical information, that we're not just approving or denying, that we're requesting, and you can legally request more information. Again, working through those designation forms through the FMLA to request that information, documenting that we needed more information so that we can give that employee an opportunity to provide that. Intermittent leave tracking. So, we know frequency varies, absences are often last minute, but making sure that we're tracking those so that we can, one, delineate what is protected absence, a non-protected absence, and also so we can keep track of that time, so we know when that protection ends. In intermittent leave, it can be quite extended, but if we're tracking in the right way, we can know when an employee has more time or when they've exhausted that time. And those employee communication gaps, so making sure that employees do know what to file, where, how they can request a leave. Again, they don't need to know all of this information, but just knowing where to start that process. And then just to add on to that, some strategy tips to build that sustainable leave strategy so that you're meeting that compliance. So having one door for every leave request, again, so that manager knows or that employee knows, here's where you're going to go to make that leave request, and we'll help you manage those details. Having a checklist that runs every time. So this is the standardized workflow. The outcome may be different, but we're still working through those, what leave laws apply, what PTO, all of those other pieces. So we can have that as documentation as well, that we've worked through that. The reconciliation between HR, your payroll, your vendors, making sure you're taking a look at that, even quarterly, just to ensure that everything has been properly deducted. And again, that manager piece, so annual refreshers on what to do, what not to do when an employee mentions a leave, or they want to discipline someone who has been out too many times that may be on a protected leave. That technology and tracking. So, whether it's just, an Excel tracker or through a leave management software, or through your HRIS, just making sure you have that one central location that, multiple team members have access to that are managing leaves, so that they know, who's out on leave, what are the dates, what are the reasons. It just helps in that compliance piece and tracking and through the admin process. And then those escalation procedures, knowing, when you've reached a point where, we should involve counsel, or when we should escalate this up, to ensure that we're making the right decision when someone's on a protected leave. Great. I know that was a lot of information, and I saw that Allison was answering some questions in real time. If anyone has any other questions, we have a few minutes. We can take those. Or, if something, comes up as you're managing a leave, please feel free to reach out to me. We'll be sending out this presentation after. My email address is on there. You can always come to Innovo with any questions about leave of absence management or benefits. We have a bunch of ongoing resources and templates. We provide leave of absence management as well. So we're happy to answer any questions or have any discussions around that.
I have a quick question while people are doing the survey, Tasha.
Yeah.
So the question is can an employee request not to take a leave, to say, no, I don't want to take FMLA and I'm going to be out for a month?
No. So if an employee is going to be out for a month, also there's always an it depends, but most likely no. If it goes back to if that employee based on your policy, so FMLA states that if an employee is out for 3 or more days, that initiates the FMLA process. You can have in your practice, in your organization, maybe it's 5 business days, seven days. But once an employee says that they're going to be out for more than whatever your policy is, or more than 3 days, you have to start that FMLA process. They can't say that they don't want to. Once you're on notice, you need to work through that process, and they need to provide documentation. And you have to go based on FMLA, or go based on your policy. Also look at what you've done for other employees. That consistency is key. But no, once you're on notice, you have to work through that process, and the employee can choose to cooperate or not. Again, they're required to cooperate in the process, and if they don't, then it's a denied FMLA leave, and they don't have those protections.
Okay, and we've just been asked to just 2 more minutes finish those surveys. So we're going to leave that up, and then we'll be sharing the HRCI and the SHRM credits.
Yep. So fill out that survey. Also, a plug, we have another webinar coming up Wednesday, June 3rd. It's going to be HR compliance checkup, what every employer needs to know, talking about doing your own HR audit. That's going to be me and Allison.